Good morning to all of you. It is such a pleasure to welcome you here today to the State of Child Welfare in Los Angeles Town Hall. It's my pleasure to welcome you on behalf of the Center for Strategic Partnerships and the Foster Together Network. It has been a whirlwind of a year with tons of changes and tons of challenges. At the same time, our local efforts have actually realized major wins in many ways to the efforts of folks like you who've partnered to move the work forward despite the challenges ahead of us. We are so grateful to all of you. We're so grateful to the many partners who've stepped up to help prevent the need for entry into care, who've helped launch new models for our youth with highest needs, and who've supported one another through crises, whether the fires or otherwise. We are also super grateful to Director Brandon Nichols for his leadership and for coming to help us today to level set around what the current data says about where we've achieved wins this past year and where there's opportunity that's ripe for us to dig in as partners and continue fighting for our youth. We have much to celebrate. We also have much more that we can achieve together. So, with that, Director Nichols, welcome. The floor is yours.
Thank you, Rochelle. Thank you, everybody, for showing up today. I guess I want to give a caveat before we dive into it. I personally put this deck together, so it may not be as polished as if it were done by my media people. I probably embarrassed them by showing it to you. And there may be some typos in it and stuff because literally I did it myself on my own computer. And I also want you to know I drew data and information from many different sources. So I've cut and pasted in from other decks and other publicly available information. Sometimes the data is a month or two old, and I'll explain to you where it is. But show me a little grace as we go through it. But overall, I think it'll give you a feel of where LA County child welfare is today. And it should also give you a feel of what's on my mind and what we at the Department of Children and Family Services are focused around right now. So with that, maybe we'll click to the next slide. So this is just an orientation to the county to remind you what the county is. And I pulled this out of our CEO's budget presentation. So you'll see a lot of focus here on money and items. This is for the whole county, but it is the biggest county in the country. We have almost 10 million residents that live in the country. We have a huge economy. And so it is a big ship to turn. If there's something we want to do, if there's a change we want to make, it's not ones and twos. It's, thousands and hundreds of thousands. And that is both an opportunity. We have a lot of resources to bring to bear, but it is also a challenge. It is hard sometimes to make changes in an environment that is this big. So next slide. This is a look at the children in our county in a comparison to other large counties. So you saw there were almost 10 million people that live in LA County. On the left side of your screen, you'll see of those 10 million people, over 2 million are children. So the Department of Children and Family Services in LA County has a responsibility to directly serve 2 million children. And if you look at the other large counties, the only other one that's really, or only other jurisdiction that's even really close is New York at 1,795,000. But even other big, like quote unquote, big counties across the country are half of our size. One thing I want to call out here, and why I chose this slide in particular to show you how many children there are, is the ethnic makeup of our county. You will see that our county is predominantly Latinx, but I want you to point to you the bar that says 7% above the big blue 65%. 7% of our county residents or our county children are Black and African American. And remember that number because I'm going to call or refer to it later in subsequent slides because I think it's an important part of our conversation. Just let you take in the slide for a second and then next slide. All right, next slide. So I've been director almost 4 years. You'll see that in a second. And this is not an official motto. We have not workshopped it. There's been no stakeholder engagement. I don't have it printed on mugs or anything. It's not on our web page. But if people ask me, what's the most important thing to you, Brandon? What are you trying to do as director? And I will say this is a sentiment that I think echoes throughout our department, is that children should live safely with their families. We have data that, and you all are familiar with it, data that shows that when a child grows up outside of their families, statistically, their outcomes are worse. They end up homeless more, they go to school less, they use hospitals more, they abuse substances more. There's always exceptions. There are stellar kids that grow up in foster care and become leaders at the national level. I mean, geniuses. But as a cohort, if you grow up separated from your family, you grow up without meaningful connections to people that love you and that you love, your outcomes tend to be worse. So, if at all possible, we want to keep children safely with their families, and if they can't be with their families, we want to make new families for them, and let them grow up in the loving arms of people that care about them. And one of the ways I talk about it sometimes is like people need somebody that miss them if they're not at Thanksgiving dinner, right? I mean, if you don't show up for Thanksgiving, you want people to notice you're not there and think about you and wish you were. Kids need that, and so we try to, like I said, keep children with their original families whenever it's safe to do so, and if not, build new families for them so that they have those kinds of connections that help them to thrive. So then I think the question becomes, Brandon, if that's the thing you care about, how is that going? And so next slide. So some of you have seen this slide before. It's one I'm particularly proud of, but this is a decade of child welfare. It closed at the closed last year. I don't have the current data for this year yet, but you will see in 2015 we had about 20,000 children living in foster care. As of last year, we were down. This says 12,500. We're actually down below 12,000 now. So we have made a significant improvement and significant strides in keeping children with family. Next slide. This is our total caseload. So this counts all cases, not just kids in foster care. This would include open cases where we're servicing a family. This would include transition age youth. This would include cases that are open for adoption. But you'll see a similar trend. In the last 10 years, we've gone from 37,000, almost 40,000 cases down to 19,000. And again, that number is actually a little old now. We're below 18,000, I believe. Next slide. This is our rate of intake. So you'll see at the bottom, it's January to December for each year. January 2015 to December 2015, January 2016 to December 2016. And this is how many children we remove from their families in that given year. So you will see that back in 2015, we removed 9,200 children over the course of the year from their families. But in 2024, I'm happy to say we only removed 4,576 children. That's a 50% decline. So 50% less children came into foster care in 2024 as compared to 2015. Next slide. So this is a comparison of how we're doing with those other counties. Again, I'd like to see where we are sort of in the pack of our peers. And you will see that this is a general trend across the country. We are seeing child welfare programs shrink, children in foster care shrink. And I'm going to talk about what I think the drivers of some of that is. But in LA County, our changes are more dramatic than almost everywhere else. I will also say that there are counterexamples. I didn't include them in, I don't want to call anybody out or embarrass anybody. And also the counterexamples are in counties or jurisdictions that are typically much smaller than ours. But there are some places where the foster care numbers are growing. But as a whole, the national trend is a reduction in foster care. But LA County really is going further and faster than most other jurisdictions. Next slide. Yeah. Harkening back to the conversation around ethnicity, these are the ethnic breakups of the kids who are in the county and in care per 100,000. So you'll see the numbers on the right, and I'll just pick the top one because it's easy to reference. 7.8 Black children per 1,000 Black children are in care. Um, but you can see that that rate is coming down. And I'm proud to say the rate is coming down more for Black and African American children than the other races because um, there is a significant issue with disproportionality. And I'm going to get to that in a subsequent slide, but I want you guys to be thinking about it because it is something, like I said, we need to talk about. Next slide. So this is just my time in director. This slide was from last year. This says 3 years. I will be 4 years in July, but just to show what my focus has been and how it's been going in terms of just my particular focus. And I have to say, I take credit for it, but I don't really. Um, I'm not really totally responsible. It is the good hard work of the department. It is partnership with community. It's leadership by our board. And I'm not just saying that to like kiss butt, but really to like turn a big giant ship like LA. One person can't do it. It really does take an alignment of stars. I would like to think that I am playing my role, and I am showing leadership, and I am messaging the importance of keeping families together. But if we didn't have a cooperative court, if we didn't have a board that supported us, if we didn't have community partners willing to step in and make those changes too, no way I, even as director of this department, could make that change. And I will also say there is huge change in the culture of the department. All the people underneath me, they have really been, I think, freed to work with families by lower caseloads. You know, in the past, workers were carrying, and um, this isn't even the highest point, but at the time I personally can remember, we had social workers that were serving 70 families at a time. So imagine a month of 30 days, they had to make decisions and engage with 70 families. It was undoable. It was barely compliance check-in. They were missing things. They weren't able to really engage to get to the bottom of issues, to make meaningful connections to services that really were tailored to meet the needs of the families. It was all very checklist and compliance, and what that resulted in is our system growing, and it resulted in children not going home. But now, as caseloads have come down, it's a little bit of a snowball effect. Workers can do what they want to do. They can really work with families. They can set them on a right track. They can take people that are hurting and heal them. They can give them hope. And so it sort of feeds on itself. And that is the magic that's happening within the department is we've been able to unleash a caring workforce to really engage and do good social work. And I think families and all of us are seeing the fruits of that. But I'm here at the top and I get blamed when things go wrong, and so I'll take some credit when things go right. I'm pretty proud that this is the slide that captures my time in this position, which I'm very thankful to have. Next slide. So with all that change and all those kids staying home with their families, the first question I ask, and you should maybe ask, is it safe? Right? I mean, the goal is not to just leave kids at home where they will be hurt. The goal is to leave kids home safely. And the question is, how do we support families to address whatever concerns there are so that their kids can remain safely with them? And I look at metrics of safety like a hawk. I literally look at them multiple times a week. And there are many different ways to look at whether children are safe or not. No single measurement tells the whole story. And that's why I have to look at a lot of different sources, talk to a lot of people. We do case reviews and keep our eyes on that all the time. So this is just one example. I've got a couple examples in the deck, but I want to share it with you because I think it's a very important part of this discussion. Again, it's not just keeping kids out of the system, it's making sure that kids are safely out of the system. And so here is one example. This is re-entry into care. So what this means is we have removed a child from their home, provided some services and intervention to the family to try to stabilize and address whatever risk concerns there were, and then return that child to the home. Then we look to see, does that kid come back in to care? Do we have to remove them again subsequently? And we look at that at a 12-month tail and an 18-month tail. So after the kid goes home, we look for 12 months, did that kid come back? And then we look again at 18 months, did that kid come back? So you will see the rate of reentry back in 2013 is 10%. 10% of the kids that went home came back in. And you can see it kind of goes up and down, up and down, up and down. Then we have a nice little slide. I wish it was a steeper slide. I wish it went a little further. And then at the end of 2022, it went up just a little bit. Um, Now, again, we look 12 months and 18 months. So the data on this is always in arrears. It's always a little further back because the kid that went home, in January, we've got to wait a whole year to see if they come back in. But what this slide tells me is more kids are not going home and coming back. And in fact, less kids are going home and coming back. They're staying home. So kids, our interventions seem to be working, at least as well as they ever did while we've made this radical decline. And arguably, maybe even a little better. More kids are sticking home after they leave care and not coming back into care. Next slide. This is another way to measure the safety. Again, no one slide tells the whole story. I have to look at a lot. This is recurrence of maltreatment. And so what this means is we have determined at some point that a kid was subject of abuse or neglect. We have substantiated an allegation of abuse or neglect. And then we look again, there's a little bit of a tail, 12 months. I think this one is 12 months. We look to see if there is a second substantiated allegation of abuse or neglect. So is the kid hurt or a kid neglected? We do something, is the kid hurt or neglected again? And you will see that back in 2014, a little over 6% of the time, if something bad had happened to a kid, 6% of the time something bad happened again within 12 months. I'm happy to say you will see that the rate of subsequent maltreatment has declined almost in parallel to the rate of us keeping kids home with their families. So again, I'd like to see it go further. I would love a world where kids are never hurt in the first place and definitely never hurt twice. But what this does tell me, and it gives me some comfort, is as we've been able to keep more kids home, our interventions seem to be working because kids that were hurt once are hurt twice less. And in the background of that, again, is the radical reduction, 50% of the number of kids coming into foster care. Next slide. Just another measurement, and I'm not going to keep hitting you guys over the head with this, but I will say safety is like the really biggest deal. And so I probably can't talk about it enough. My folks are probably tired of hearing me talk about it. Recurrence of allegations. This means there was a hotline call. Somebody said they're worried about a kid. And then we look to see if there's a subsequent allegation where we substantiate, in fact, the kid was hurt. So maybe we didn't even intervene in the first place. But, this is kind of like, did we miss it? But when a call comes in, we do something or maybe don't even do anything. Do we get a second call and we figure out, oh no, this kid really was injured. This kid really was being neglected. You can see that is also nicely trending down. These are all small percentages. We're talking large numbers here. Any declination is a pretty good one. Would like to see it go further, but add it all up. All of these measurements, all these slides point in the same direction, and that's what gives me some comfort. When multiple data points, multiple ways to assess the system, multiple perspectives on an issue, all kind of point in the same direction, then I gain some confidence that maybe it is telling an accurate story. And all of these and more point to kids are at least as safe as ever, if not safer. Going to the next slide, this is the ultimate awful way to have to measure a system. But this is the one that the press likes to talk about. This is the one that gets attention. This is one that we have to take seriously, and I can't just ignore it, and we can't not talk about it. And these are the children that die in the county every year. And so I've put a little red box around the top, and I want to explain to you what this row is. This means each of those numbers, and this is again, the saddest metric I could imagine. These are the children that died from abuse or neglect. So these are not random car crashes. These are not, being born with medical conditions. This is not, acts of God. These children were abused or neglected. And this top box is the parent or caregiver had some history with our department. We'd had some contact with them at one point or another in their history. And maybe it was before this child was born. maybe it was with this child, but we've had some contact with that family. Um, so it's sort of the worst measurement we could have. But again, got to look at it. I can't turn my back to it. And any one death in this category is too much. And I personally, and we as a department are somewhat obsessive about these cases. We look at each of them pretty carefully. We try to um, make systemic changes. We redesign policies. We work hard to. This is like our battleground to bring this number down. I will say, fortunately, the number is relatively small compared to the 2 million children in the county, but even one is like a tragedy, literal tragedy. That said, the numbers have not gone up as more children have stayed home with their parents. In fact, they've trended down a little bit. And this only goes to 2024. Our report for 2025 was just released. It's publicly available. I believe it's on our website. If not, I can work with Rochelle to get people copies. And last year we had our lowest year in a long time. So I don't want to say comfort because there's nothing comfortable about this, but it does tell me that we're not having more children in their families die of abuse after we've had contact with their families. Again, that aligns with the other metrics, which tell me that the changes we're making to support kids staying home with their families seem to be protecting them at least as well, if not better than ever. So, next slide. This is in reflection to the child fatality box that we just talked about. It tells me where in the county this is happening. So again, there's a lot of different metrics and data points I use to try to identify hotspots in the county, or for me to understand, which communities seem to be struggling more than others, which communities seem to have more effective services than others. Where do we need to focus attention? Where do we need to make investments? So SPA 1, this is the number of children over the years who have died at the hands of their parents because of abuse or neglect. 26 kids going back to 2015. So SPA 1 is the Antelope Valley. For those of you that don't know the county nomenclature, that is Palmdale and Lancaster. And that is the area that has gotten the most attention, I think, publicly and in many of our conversations. There was a Netflix documentary, as you know, or many of you know, about a particularly bad death in the Antelope Valley. And Antelope Valley definitely is a challenging area for us to service. We have many strategies. We've worked with Supervisor Barger's office. We've worked with the community up there to try to get resources in the Antelope Valley, to try to meet the needs of the families that are living up there, try to keep kids safe up there. But something that I think is interesting about this slide is that you'll see historically there are other parts of the county where there have been more deaths than the Antelope Valley. And SPA 6 is the big one, and SPA 8. So SPA 6 is South Los Angeles. That's Compton, Carson, Water Ridge, Vermont Corridor. Probably missing one, just run off the top of my head. I'm sure I am. And then SPA 8 is like the South Bay. Those are areas which also are hotspots and also deserve attention. And so when you'll see in subsequent slides, I'm trying to make some investment into SPA 6 because it is an area that has similar demographics, similar safety concerns, similar service challenges to Antelope Valley. And we haven't been talking about it the way we have been talking about the Antelope Valley because, again, I think there have been a couple, and to say sensational minimizes the tragedy of it. And I don't mean to say that, but a couple cases that really were focused on by the media for whatever reason in the Antelope Valley. And we have not had those same conversations and that same focus in SPA 6, even though the data tells me that SPA 6 needs it just as much. Next slide. So this is, again, back in reflecting back on the children that have died at the hands of caretakers by abuse or neglect. How old were they? And you can see, and it's not surprising, but I don't know if everybody thinks about it. But it's the little ones. little children are by far more vulnerable to serious injury and ultimately and sadly death um, than older kids. Older kids are just more resilient. So you will see the 0 to 5 category dominates the number of children that have been significantly hurt. Um, and that provides me uh, direction or information to better focus our work. I think 0 to 5 is a very vulnerable population that we need to be doing a little bit deeper dive on and improve our practice around because small mistakes there, like 3 days of no food for a 6 month old is real different than 3 days of no food for a 17-year old. So we gotta lift up that 0 to 5 population. I'm trying to shine a light on it. I'm going to talk in a little bit about some of the efforts we're putting in place to improve our support for little ones and families with newborns. Next slide. So here's what our system looks like today. And this is a current slide. I just pulled this is like for last month. You can see, and the way it's broken out, I can't really show you 0 to 5. I can show you 0 to 4. But you can see that about 28% of our system right now are little ones. Collectively, the 0 to 4 make up the largest chunk of our system currently. But the other chunk I wanted to lift up to you is 18 and older. So these are the transition age youth, 18 to 21. And you'll see that there's a lot of 18 to 21-year-olds in our system. 2,435 kids, 13% of our, little over 13% of our system. This is not a good thing, but it is an opportunity. We know each of those kids. We know their name. We know their history. We know their social security numbers. We know who their friends are. We have their cell phone and we can call them. There is a real ability to work with each one of those kids as an individual, not just as a number, not just as a statistic, as they get ready to leave our system to try to give them the best launch we can. We've got a lot of efforts underway, a lot of partnerships with some of you to do that. But I will say, and you don't have this in a slide, but you can just trust me on it, roughly around 720 kids leave our system each year. But that 720 number is digestible, even as a system as large as ours, even in a world of over 2 million children. Like we could all lock arms around 720 kids. Like if each of you took 10, we'd be pretty close to that number already. Like we could make a difference for a concrete number of kids that we know. I mean, we in some instances sadly raise these kids. We know them. It's not just again a theoretical. It's not just a statistic. Although I'm showing it to you as a statistic that 700 kids are going to leave our system in the next year. That's a call from me to you and anyone else that'll hear me. Can we do something better by 700 kids? I feel like in a county of our size, with the resources we have available, like that's something we can put together. But the other thing I wanted to call out on this slide is the ethnicity, and that it's kind of I pointed you to it a couple times already. But you saw at the beginning of the children who live in LA County, about 7 to 8% are Black or African American. But if you look in our system, the representation of Black children is 26%. So although 7 and 8% living in the county, 26% within our system are Black and African American. And I will tell you, you can look at any data point in our continuum. So you could look at number of hotline calls. You can look at number of social workers that go out and knock on doors. You can look at number of children removed and placed in foster care. You can look at number of siblings placed together. You could look at the time children spend in the system before they're reunified. You can look at the success of adoptive placement. It doesn't really matter what question you ask of the data, almost across the board, you will see that Black children are overrepresented. Their outcomes, their flow through the system are almost uniformly significantly worse than their peers of other races. And we have a lot of efforts in place to address this. And I will say the number of Black kids in the system is coming down. You saw that earlier. There is some progress made, but the difference, the disproportionality between the representation of Black families in our system and other racial families in our system is narrowing pretty slowly. I am saddened and like personally upset that we're not making more progress here. It is something we got to keep talking about. We got to keep trying new ways to bring this in line. Black kids deserve safety, but Black kids also deserve not to be ripped away from their families more than their peers. Next slide. One of our focuses over the years has been a reduction in congregate care for a lot of different reasons. We understand, and I will say, and I've said publicly and to members of the legislature and the administration, some kids need congregate care for some period of time. There are some kids who, because of the trauma they've been through, their behaviors, their challenges, they need a structured setting and a clinical like intervention for some time to stabilize them and get them back to a family like setting. But we had a bad habit, as did most of the state, and I think the country as well, of warehousing kids in large congregate settings. But we're getting better. And if you extend this beyond, this is just back a decade. I tried to pull decade, like 10 years, because I figured it was a good time frame for most of these. But if you went back another 10 years, you would see that we were well over 5,000 kids in congregate care at one point. Now we're kissing 200 kids in congregate care. And I will say our congregate care settings have professionalized. They do have clinical resources and attention that was not the norm 10 years ago. And that the kids that we are placing in congregate care, it's not just willy nilly. It's not just a place to warehouse them. It's not just because there's an open bed and we don't know what else to do. It's because these kids have significant behavioral health challenges and clinical needs that do better for some time in a structured setting. Um, I don't know how much further this is going to come down, to be honest. I think there will always be some need for a structured congregate setting in a system that deals with traumatized children. It may come down a little further, but we've made a lot of progress. And as a guy that's been in the system 30 years or so, I'm pretty proud of having had some part in this progression. Next slide. So where are the kids in congregate care living then? Well, there's not surely most of them. A lot of them are living home with their families because we're not having to take them in the first place, because we've been able to provide resources and stabilization to the families. But when we are taking kids in, we've made a big push, as most of the state, and I have to thank state leadership in helping resource this, in placing children with their relatives. So you will see right now the biggest bar in the bottom right corner, relative placements, 50%. Right now in our system, 50% of the children that have been removed from their families are placed with relatives. And somewhat, this is a legacy number. This reflects, placements going back years and years and years. Our current placement rate for some of our offices is in the 90 percentile range. So if they're taking a child 90% of the time or better, they're able to identify and support a relative to help take care of that kid. And data has shown, and our experience in data continues to show, that kids placed with kin tend to do better than kids placed with non-relative caretakers. It's, they share blood, they share commonality, they share a love and a history that just seems to make a difference. There is more stability there as well. I have a slide on that. I didn't throw it in this one. But the investment we've all been making into identifying and supporting relatives is paying off, and our relative caregiver rates is increasing month after month after month. But I also wanted to throw in the ethnicity slide here again, just to reiterate the point in a different way. You can see the bottom, the blue bar for each of the ethnic types is the prevalence in the community, and then the green bar is the prevalence in child welfare. So you can see for the Black community specifically, because that is where the greatest disproportionality is, 8%, although it's a little less than 8%, 7.6 or something, I think, rounds to 8. In the community, 28% in our system. I would be remiss if I didn't call out the American Indian Alaskan Native population. It's really hard to see because there just aren't that many in the system and in our community. But the disproportionality is actually very similar to the disproportionality in the Black community. If you could zoom in on that bar, and if I'd done that, this would have been a hard slide to make. You will see that they experience similar disproportionate treatment within our system. LA County is not home to any federally recognized tribe, but we do have a lot of Native Americans, particularly Mexican recognized Native Americans, and it is a point of focus for our department. We have specific laws to address the needs of the Native American community, and we have specialized staff and trainings to strengthen our engagement of Native American families and their tribes. Next slide. So this is a little complicated, and I'm not going to bore you with too much of the details, but there are federal measures of how safe children are, and federal measures of how a child welfare system is doing. And every jurisdiction across the country has to measure these things and report them up. 10 years ago, if you'd asked me, I would have said these things were all aspirational. Like, picking a percentage of how many kids are injured twice is kind of just a made up number, to be honest. There's not a lot of science behind it. So you pick a goal that seems reasonable based on experience. And I would have said that goal was just some bright light out in the distance that we are all trying to march towards. Constant improvement, right? You never get to the promised land. You always just try to do better, do better, do better, do better. But I will say, as caseloads have come down and our social work practice has gotten better, we've actually started to hit these goals. So this is a dashboard which shows for the whole department our performance around safety. And for me, again, you'll see at the top the two safety ones. This is the most important part of the conversation. We are meeting the federal measurements for safety. And then the second half of the screen, the 1, 2, 3, 4, 5 dials on the bottom, this is a measurement for permanency. Are we getting children back home, or are we placing them into adoption? Do they have some stable arrangement? You will see that we were almost in the green across the board for permanency, which I never thought would happen, to be honest. I didn't think it could happen. I didn't think the intention was that it happened. I just thought it was a constant carrot, hanging out in front of us that we were supposed to just keep walking, trying to get, but that we'd never get to bite the carrot. In fact, we're getting nibbles of it. Pretty happy about that. Next slide. These are all the measurements for all of our offices. We track them by office. And you will see in this slide that, I think in this slide, it's a little dated. There are 2 offices which have hit all the federal measures. They are green across the board. Many of the offices in this slide are almost green across the board. Since this slide was pulled, we've had 2 or 3 more offices that are now green across the board. They are meeting all federal measures. Again, a thing I never thought would happen. I think we're in striking distance from passing all the federal measures in a short amount of time. This slide also tells me where there may be some struggles and where we need to focus attention. I can leave it up here for a second so you can see where the areas are in the county that may be struggling, but the one I want to call out is the top slide. You'll see, a chunk or the top section, Bureau 1 is it's denoted on this slide. You'll see a chunk of red around reentry to foster care and some other areas. That is our SPA 6. That is South Los Angeles. It is an area that continues to struggle, that continues to need investment and resources. And let me just leave this up here for a second while I talk a little bit longer. The issues in SPA 6 are longstanding and significant. I don't want to not take responsibility for them. We are responsible for a lot of the performance that you see on this slide. But DCFS alone is not going to be able to fix the problems in SPA 6. We are not going to be able to fix the societal issues that exist beyond our doors in Compton, Carson, Hawthorne, Vermont Corridor, Wateridge. It will take a community lift. And we are seeing community come together in SPA 6 to give greater support to families. But it does take that kind of locking arms. It does take public-private partnership. It takes political investment. It takes money. It takes job opportunities to move something as large as that whole area to a point where families thrive and children are safe. We have a role to play. We're trying to play that role, and I've got plans to do more, but it's going to take more than just us. So I encourage all of you to think about what you can do to spread the word, talk to your partners. How can we help that area of the county that is struggling, and the families and children in that area that need our help? Next slide. So why is all of this happening? So I've talked already a little bit about lower caseloads. I do think that is part of the secret sauce, and it's sort of a bureaucratic thing, and everybody expects, a director of a department to say, I need more staff or something like that. But there is some truth to this, in my opinion. Like I said, back in the day, 70 families a month. You're expected to visit with a child on your caseload at least once per month. That means you were making multiple visits a day to get to see all of them. And those visits were effectively drive-bys. You just check the box. You just say, yes, I was there. Kid was alive, and you move on. You don't go out to dinner or a lunch. You don't sit down and really have a conversation. You don't get into, hey, how's it going? Do you need any help? It's just you do what you're mandated to do, the minimum requirements, and you move on. We've gotten to the point now where caseloads, I think on average, are about 13 or 14 in some offices, and that allows social workers really to dig in to what's going on with the family, to dig into what's going on with the kid, and to make differences. That is driving a cultural change. Workers are less compliance based and more doing real social work. And they are focused on different targets. It is not just court compliance. It is not just checking a box and covering their backs in case something goes wrong. It is them wanting to and being able to heal people that are hurting. We have also focused more on parents and fatherhood. So there was an awful saying, just horrible, and I hate to repeat it, but I am going to repeat it because it will give you a sense of what real culture was like back when I started, and I started in 96. I remember a lawyer saying in the courtroom, parents are just speed bumps on the road to adoption. And, that was an extreme statement even then. But it was, the fact that they were even comfortable saying that, it was reflected of the mentality. Parents were the perpetrators. They were kind of the bad guy. We were a system that was just going to take kids away to make sure they were safe so nobody got in trouble and adopt them out to new families. That culture has changed significantly. We have focused on parents and the needs of parents. I've recently reorganized the department, and one of the reasons I did that was to create an area which I think for the first time focuses on parent services to identify what parents need, to survey the community, to see if those needs can be met out in the community or whether we need to build some resources, and to really take care of parents in a focused and meaningful way. We were a child-focused system in the past, and we still are, but now we're a child and family-focused system. I really do believe that, and that has been behind a lot of these changes that you see. And I put fatherhood in there. It's a specific initiative, and there's always more detail in all these slides and all these bullet points. But we have really started to think about and engage with fathers in a way we hadn't before. And those relative placement or the relative placement slides and the rates of children staying home. Behind that is a lot of us placing kids with their fathers. Sometimes a father and a mother have separated in a stereotypical situation. Father has gone on and created a new family. Mother is struggling. Father has no connection to the children. He and she have not spoken in years. But now we'll go out, we'll find that father, we'll assess whether he's capable of caring for his kid, and we'll make that connection. We'll reunite a father and their child. And we're doing that successfully again and again and again. And I will say we are doing that in the Black community significantly, and we're seeing significant returns in bonding fathers and children safely and successfully in SPA 6. That leads into the next point, which I want to make. And some of this is scientific. There is some study behind it. Some of it is anecdotal. Some of it is just my personal thoughts. So take it all with a grain of salt. And these are the kind of areas I love to talk about and debate and discuss, because there's a lot of different ways to look at these changes. But I really do think we're engaging with community now in a way which we never did before. We have humbled ourselves to some degree and have genuine conversations with community. And I think we're more transparent and more genuinely engaged. We have, and I put ERDD on here and cultural brokers as a specific example. Sometimes when we are making decisions on a case, should this child be removed? Is this kid safe with their parents? Are there resources that can address this concern that somebody had or that we have? We have community representatives there at the table with us. We have cultural brokers sit at the table with us to explain to us and to the parents what's possible, what's going on, what needs to change, to explain to us the landscape of the community. There's this resource right down the street, and they're good people, and they'll watch the kids, on the weekends while parent attends a class or something. And those cultural brokers, they don't get to make the decision. Ultimately, we own the decision. I want to be honest about that. But they get to influence the decision. They provide us with a better understanding of the situation. Really have been key to some of the changes and progress we're making in SPA 6. I've been able, and this is another point of personal pride, to grow our cultural broker program. I found a little bit of money. Underneath all of this, sadly, because the real world is money. Cultural brokers should be paid. They're not doing another job, they're doing this. But I was able to find a little money to grow our cultural broker program, but I think it needs to grow more. I think we have a greater need for cultural broker intervention and assistance than we're capitalizing on today. But I am seeing changes come about as a result of things like that. Care Portal is another great partnership we have. Care Portal, I don't know how familiar you are with some of this. I saw Wade was on, and I mean, not Wade, Glenn was on in the chat. I know Glenn has worked, and they've Change Reaction has helped sponsor Care Portal. But Care Portal is an agency that connects the faith-based community to the needs of families. And it's so slick. I mean, they use an electronic platform. You can enter a need for a family. This family, I'm just going to make one up, but like this family needs a refrigerator. They don't have good, clean food because their refrigerator is broken. They don't have the money to get a refrigerator. Care Portal helps connect a faith-based group like a church or a temple, a synagogue, with that family, and they can provide, they come together with their own resources, buy a refrigerator. Care Portal helps get it to the family. We are growing that as much as we can, because it's those kinds of supports to families that stabilize them and keep their kids from having to come into child welfare. FFPSA, hotline to helpline, I'll just touch on those quickly. There is a change across the country to focus on prevention. Many of the things we are worried about, transition age youth is a good example, would not happen if we were able, or we wouldn't have to worry if we were able to keep kids safely home with their families in the first place. Prevention is probably the best medicine for many of our ills. And the federal government, for the first time, really has made a significant investment in prevention in the child welfare space. And FFPSA is the acronym for that law, Families First Prevention Services Act. We in LA County are getting ready for FFPSA implementation. It has not happened yet in California. California is about to enter into FFPSA and start being able to claim federal monies. But we have had one-time money. It's grant money, basically. You can think of it that way, to prepare the community, to prepare our systems, to prepare our ability to draw down those federal dollars. And we're already seeing the benefits of these programs as we do it on a one-time sort of pilot preparation basis. Next slide. These are just some of the other things we've done, which I think are making our decisions better. The one I wanted to call out, well, actually, there's two I want to call out. Lived experience, I think that's the third bullet down. Really, we haven't tried to capitalize on using peers and near peers wherever possible. So again, one of the things I'm personally proud of, because I have had a hand in it, but it is not just my baby, is we have, they're called PIPs, parents and partners, but these are parents that have been through the system themselves. They have experienced from the parent side child welfare. We have put parent partners in all of our offices who can hold the hand of new parents as they enter the system and guide them. Not only is it just a less traumatic experience, those parent partners really are like speaking from a place that the system can never speak from. They can offer real world insight and thoughts that, in a trusted way, that a social worker just can't because of the position and privilege that we hold. If you talk to the families that have had a parent partner, or if you talk to the parent partners themselves, I challenge you not to get a little bit moved. I mean, I'm a tough old guy and I don't cry much, but when I go to the meetings with some of these, and I can set some up for you because it's very compelling. You'll feel it in your heart. You'll feel it in your behind your eyelids. Um, it really makes a difference, and it's like such a better, caring way to treat for families that are coming in contact with the system that sometimes just chews them up, especially in the past. The other thing I wanted to point out is the involvement in the National Partnership on Child Safety. Again, child safety really is the biggest deal, and I don't think I've been talking about it enough. I don't think we talk about it enough. But we are one of the leaders on the national level around addressing child safety nationwide. Very proud of the partnership. We were one of we were in the first cohort of jurisdictions to sign on to the partnership, and it's where we talk about best practices and ways to make sure we are focused on and enhancing child safety. The add on to that is I think LA County now, and I will take a little bit of credit, but it is seen as a leader in many important ways. We are a jurisdiction that's now hosting other folks. We have people asking us, like, what are you doing there? How's it going there? How'd you figure this out? And that is something that I think we can all be proud of because it has been more than just DCFS. It is that change in the community. It is that alignment of courts and community and politicians and our department, and like so many different things have come together here. It is an LA change, not just a DCFS change. Although, like I said, I'll take credit for some of the DCFS change too. Next slide. These are just some of the things that we have worked on together that have been particularly innovative and have gotten attention. So I wanted to call them out here. Therapeutic shelter home, therapeutic family home expansion. This is the one I really want to talk about. You will remember if you've paid attention, maybe 3 years ago, we were in the LA Times. I think one day on the cover, top of the fold. That's like the spot you don't want to be in if you're the child welfare department. And then a subsequent article, I think just a week or two later, because we had youth in hotels, and those youth in hotels had assaulted staff, had bad experiences themselves. It was not good. I will not make excuses. I will say that practice grew in part during COVID when we were scrambling to just keep kids safe and healthy. But it continued far too long, and it was not a good model. Those kids were not getting services in the way we would expect. Those situations were not safe. People were getting hurt. It was a mess. But we didn't have a great alternative at the time available, and we have worked with the provider community and developed alternatives to hotel placement. And it is something we created here in LA, sort of out of whole cloth. We're calling it the therapeutic shelter home, and we are now expanding it. And this is one of the things that has led to us being able to completely abandon our use of hotels for our children. We haven't had a child, I'm knocking on wood here, haven't had a child in a hotel in over 3 years, I believe. And this is one of the ways we are successfully placing kids on very short notice with very high needs outside of hotels and keeping them safe. We are also working on innovative models of care. That is a little bit of a buzzword, but it is state money, and we've partnered with several agencies in LA County to try to show a different and better way to serve children with particular needs. And so you will see some of the needs we are focusing on here, but it includes LGBTQ kids, expectant parents, CSEC kids, and also kids with autism. So some populations need to be addressed in different ways. Sometimes they have different and unique challenges that we want to adapt to meet them where they're at to do what they need. And this is a program with which is using state money to pilot different ways to do that. Next slide. FFAs, and I saw Anna was on here. I don't know if any FFA agencies are on here. I've been challenged. That is true. Our population is going down. The number of kids coming into care are going down. We're placing more kids with relatives, and it's put a lot of pressure on them. And to add to that, we have all been sued a lot. LA County has been sued a lot. The FFAs has been sued a lot. The cost of litigation and the risk of this business has increased significantly. And the primary insurer of, I believe it was 90% or so of the FFAs in the state, stopped renewing insurance policies. FFAs have had to scramble to find new insurance, and those new insurance quotes are coming back higher than ever. We are trying to work with FFAs to both keep them around. I believe that we need FFA resources and FFA beds, and that they can offer something to our system that is not available elsewhere, and that there's not a time in the imminent future where our system would be successful without FFAs. We need those folks around, but also to maintain infrastructure focused on child welfare that will be lost if those agencies go out of business or change their lines of business to focus on other things. So this is some of the work we've done with FFAs to try to support them and partner with them. But bottom line, it has been a diminishing number of kids in FFAs. A couple other things I want to call out here. I mentioned I did a reorganization. One of the reorganizations was to create a new unit. It is the YES unit. It's the bottom right box on your screen, to really focus in a meaningful way on the needs of transition age youth. We've been a little disjointed. We've had some silos. My intention, and this could be a whole hour-long talk in and of itself, but to really change the way we focus on, work with, and help transition age youth. Next slide. So these are some of the things we worked on in the last year. Again, I've been talking a lot. I want to get to some time for us to have a little bit of a discussion. But a few things I want to call out. Firstly, it's been a challenging year. I mean, there's just truth to that. It is hard to think what we want to do in 6 months, hard to think where we need to be in 12 months when we are reacting to unplanned and significant events. So I put some of those events down in the bottom right corner, just as an example. We've had immigration raids, which have affected our youth and families. That food insecurity, we had a phased ending of the CalFresh program, a food program that many of our families rely on for basic sustenance. There have been safety net cuts, and there will be more safety net cuts coming. And when I say safety net, a lot of that is our public health department. Their home visitation programs are being impacted. Their substance abuse programs are being impacted. They recently announced that they're closing 5 public health clinics across the county, including, my understanding is, the one public health clinic that served the Antelope Valley. We had wildfires. Again, I'd be remiss if I didn't call out Glenn and Change Reaction. We stood in a auditorium together to hand out checks to families impacted by wildfires. But I did not have wildfires on my bingo card this year. I guess I probably should have. I was not planning, but I was thinking, what is it I want to accomplish this year? It was give checks to families who lost their homes in a wildfire. That was not something I was planning for. We did the best we could, but it was a distraction from the other kinds of progress I want to make. It's a distraction from the long-term, multi-year visions that I have for the department and where we want to head. And unfortunately, I feel like it's going to be a busy year this year. We've already had some stuff at the start of the year, and I think the hits are going to keep coming. So we have to remain nimble and adaptive, which is like the biggest weakness of a system the size of our county, right? I showed you the size. To turn a ship like that in a week on a dime is near impossible. And that's where a lot of our community partnership has really helped, because small partners, people with flexible money, people who don't have to follow, bureaucratic contracting rules, can step into a gap quickly while we on the ship figure out how to turn the wheel and get there in a few months. And we've really demonstrated that that model works in a few real world crisis moments. And I fear that we're going to be called to do it again, and maybe again. Next slide. So these are some of the people I was just talking about. This is not a comprehensive list. You're probably wondering, where am I on that list? And I missed you. I'm sorry. But like really, really, there are some consistent players that are there again and again that we work with. I can't thank them enough. They are helping do all those good things I've talked about. And we're going to continue to work together. Next slide. So what am I working on right now? Young children in care is a big one for me. Like I said, I've reorganized the department. I'm trying to create a new unit. Those 0 to 5 kids need some expertise and focus. We didn't talk much about hotline to helpline and ARS expansion. That also goes with mandatory supporting initiative. I want to reflect back on the disproportionality of our system. There's a report out there, scientific report done by a statistician, which says in California, if you are a Black child, you have a 50% chance of having a hotline call on you sometime before you turn 18. Every other Black child in the state, statistically, will be called into the hotline at some point. In LA County, there's another study that put the number like a little over 30-40%. So maybe we're like slightly better than the rest of the state. I'm not sure. They also use different sources of information, so there may be something there. But nevertheless, too many Black children are the subject of hotline calls. How do we get into the community? How do we support Black families so that people don't feel like they have to call the hotline? And I want to say this to anybody listening. If anyone's ever really worried about a child, Black, white, otherwise, call the hotline. Black children deserve safety. But if you don't think that a child's going to be hurt and you're just looking for a way to support the family, if you're just looking for some access to services, help me build a better access point than the Child Protective Department. There should be an easier face. There should be a friendlier response. There should be more supportive, easier to access interventions in a community, short of calling the child hotline. Only call us if you're worried about the safety of a kid. I mean, that's where we're trying to get with the mandated supporting initiative. And we're making progress. We have run some pilots. We're doing some pre-petition legal counsel, which you'll see on this slide. It's getting there, but that is a huge culture shift, not only within my department, but within the outside community as well. Next slide. Here's some just upcoming things that are going to happen in the state, which are going to impact us. CARES migration, this is a change, and this is so bureaucratic, but this is a change in the computer system that we use. We all across the state use one case management computer system. It was built, I don't know, probably 20 years ago or something. I mean, it is old, old, old. And, imagine running a system without an iPhone. That's what this system's like. We're about to move to a high-tech new system, but that change is so significant and fundamental. It's going to touch every single social worker, every single person in our department, and every single department across the state. It's going to be a challenge. It is going to take a lot of attention. It's going to take a lot of resources. We're going to have to do a lot of training, and it is something that is going to make some of the other stuff difficult to do when CARES comes up, because we're going to be so focused on CARES. Rate reform is a proposition put forth by the California Department of Social Services. They're sort of our mother department at the state, and it represents a significant investment into the foster care experience. We're talking $1 billion of state money to meet the needs of children, and it will allow not only for better access to mental health supports, but also to what you might think of as recreational or life-enhancing things. Quinceañeras, football games, guitar lessons, all of those kinds of things that could make childhood a much better experience for the first time in the state will be funded as an entitlement from the state for all the children in the county. there's a big cost to that. The state's going to write a big check. They seem poised to do it, but it is coming at a time when there are state budget pressures, and it is going to take a community of support and advocacy, I think, to push that across the line. I will say, yeah, there's some details there that need to be worked out. There's some hard conversations that are going to need to be had. But my hope, honestly, is let's get it on the books, because I do think it's a once in an administration opportunity, and work out the problems downstream. Because if we miss this window of opportunity, I don't think we're going to get to have this conversation again. And then funding transitions. There's a few things I wanted to touch on here, but I mentioned the one-time grant-like money we're getting in preparation of FFPSA. There are some other one-time monies that the state thankfully put on the table when state coffers were flusher, but those monies are disappearing. So the programs we've built on them, the money we put into the community, is going to go away from the state. We have to find alternative funding sources. We have to maybe move things around within our department's budget, stop doing something else to keep funding one of these things if we think it's more valuable. But that is going to be a challenge for us. It's something we're already working on. It was part of our budget presentation to the board this week. But there is a significant amount of one-time money, which frankly is just going to run out in the near future. So I've talked over my time. I did want to make some time for us to have conversation. So I'm going to stop now. Raise your hands, put things in the chat. I've asked folks at FTN to help me monitor the chat, but let me know what you'd like to talk about.
So we have an incredibly rich chat, incredibly rich. I'm going to pull out, just so you all know, the questions that Dan, Glenn, Dr. Ivy, Anna, Alex, Anthony, and Angelina put in the chat that are specific to data clarification or elaboration. We're going to do, just looking at the time and knowing people are going to want to interact with Brandon on forward-looking stuff, we are going to get answers to all of your questions and send them out to everybody, because there's so many that require depth around the data. So we're going to focus on the questions that are forward-looking, so that you guys have a chance to talk with Brandon about those. So one of the questions that Christina Hall put in was, are there plans for investment in Spot 8 since the child fatality rate seems to be going up over the years?
Could you repeat that, Rochelle? Just kind of cut out for a second.
No problem. Are there any plans for investment in Spot 8 since the child fatality rate seems to be going up over the years?
Yes, there are. But I will say, and I don't want to hide it, SPA 6 is my first battleground. I have to plant the flag somewhere. And even those spas which didn't hit like the high numbers, like Pomona, we have challenges in Pomona. It's not that we're turning our back on them, but SPA 6 stands out for a lot of different reasons, including that one metric that I showed you as being the first in line for investment and attention. But SPA 6 and SPA 8 are geographically pretty close. And the families don't recognize our internal bureaucratic lines between spas and where our offices reach. And our offices have zip codes sometimes that cross spas. So I will say an investment in SPA 6 does bleed into SPA 8 as well. But SPA 8 is on my list of things to do, certainly.
Awesome. One of the other questions was, can you elaborate on where you think DCFS will go with stepping down youth out of STRTPs from here? What types of supports have been most impactful so far, and where are you planning to go to continue to move kids back to the community?
Yeah, so there's a couple pieces to solve that puzzle. One is having family-like settings in the community that are able to deal with kids with significant behavioral health needs and dynamic needs. And that's something I guess I want to call out. A child's status is not fixed. They have good days, they have bad days. They have seasons where they're more upset and more stabilized. And really, especially with the kids with the higher levels of needs, there is a fluidity to them moving in and out of different placements. We, want to have a continuum, and this is part of the crisis continuum pilot, where kids can be in a structured setting when they need it and be in a community setting when they don't need it. We need to develop those community settings. We need to develop the connection between community settings and STRTP so that they can flow more easily in and out. One of the problems we've had in the past was not enough STRTP beds, to be honest. So when a kid needed it, they couldn't go back to the place they came from because that place was now full. So part of the continuum care pilot was to have beds that were always available for the kids that left them. Um, Beyond that, discharge planning is a really big deal for us. We have historically moved kids on very short notice without a lot of forethought and planning. We're getting better as the system shrinks and we all get a little more sophisticated in making the moves meaningful and planned rather than middle of the night. So discharge planning will remain an area that we have to focus on to make that flow in and out much more smooth.
Thank you. One of your areas that you made a call to action around was prevention. Jeremy Loudenbach asked a question that relates to this. Can you expand on how recent federal funding reductions and policy changes to the social safety net may affect our child welfare system? Do you anticipate that it will result in more parents coming to the attention of DCFS? And I'm going to tack on a little addition to that, which is since this is a call to action area, if you do anticipate affecting kids entering DCFS, how can we best help? How can we partner with you?
Yeah, I mean, I think that's $1 million question. I mean, that's a big one, and it's one that I am asking myself and don't yet have a ready answer to. I will also say it's a dynamic situation. The federal policy and federal reductions are an ongoing conversation. We don't know exactly the details of all of them, whether there's more coming and how exactly they'll hit. But I'll give you some examples of my thought process and how this might play out. And I'll use substance abuse as an example. If a parent has a substance abuse problem, there is some chance that their child is at risk living in a home of a substance using parent. The child's exposed to substances, and we have had cases where children have ingested substances with bad outcomes. Parents can become neglectful as they focus more on their addiction than their children, et cetera, et cetera. If funding for substance abuse services becomes restricted, and it is already, less families will be able to access substance abuse treatment services, meaning they will stay or drift further into their addiction potentially, meaning their children become increasingly at risk and more likely to come into child welfare. Or if they've come into child welfare, they won't be able to get the treatment and intervention they need to get their kids back. And we are already seeing that starting to happen now. I will say our volume of calls has not gone up, but we started to see this in the substance abuse world, conversations around restricting access. If you go back 2 weeks ago to board testimony, I think it was the board 2 Tuesdays ago, or maybe 3 Tuesdays ago, you'll see Dr. Ferrer talking about this subject specifically. They are worried about losing resources in their substance abuse programs. And that is just but one example. Again, home visiting nurses, we believe, have a stabilizing effect, particularly with young mothers. Those are the mothers with kids 0 to 5. If those programs become more restricted, those 0 to 5-year-old kids, those mothers, may be in a more risky situation, and there may be hotline calls related to them. All of those outside programs, which I don't directly control, are the stabilizing factors that may make a difference between a child being at risk or a child thriving and being safe at home. And as they start to fall, more and more children may become at risk, and more of those children may have to enter into our system. I mean, and if we're not able to access those services on behalf of our parents, once they're in the system again, it'd be harder maybe for them to get their kids back. As of right now, I can't tell you what all is at risk. We're like sort of constantly assessing it, constantly talking about it, and it is happening in programs like outside of DCFS, which I don't have direct oversight of. And really, I don't have the understanding of their budgets the way I do our budget. So I myself am trying to figure it out. I also will say, as prevention becomes more of the focus, DCFS and child welfare fades into the background because hopefully we're not called in the first place. If a teacher has concerns about a child not having food or looking dirty, maybe they're not calling the hotline because they're not worried that the kid's unsafe, but they're calling another agency, another resource to help get the kid food or help, find out, well, why is the kid dirty? Is it just plumbing? Like maybe let's fix the plumbing. Um, so we've been on a trend countywide towards other departments stepping forward, and I guess taking responsibility for stabilizing families and only calling child welfare in the extreme. But as those other departments scale back, I don't know if there's going to be layoffs, but that has been discussed publicly at the board, the potential for layoffs. As those departments lose resources, DCFS, sadly, to some degree, will always be here and will be stepping into the gap. But that is going to result probably in greater increases in the child welfare system. What can the community do about that? Well, the biggest one is advocacy. I have said, and I am a partisan here, and I know this is kind of an ugly thing to say, but put children and families first. There's a program, and there's two people that need one slot of that program. Give it to the children and families in limited resources. I hate to do that, but I think that the impact and the preventative effect of addressing needs when people are young prevent a lot of cost and years and years and years of downstream costs. So I would ask for anybody that agrees with that to do what you can to advocate for children and families. I call it getting a fast pass, being to the front of the line. The better argument, of course, is just more resources. There shouldn't be a choice between a child and someone else. But if there is going to be that choice, choose the child. I am, like I said, a partisan on that, admittedly. We are also going to be needing assistance navigating diminishing resources. Some of the resources we depend on now will maybe disappearing. It's going to be harder and harder for parents to access them. We need to, and this is one of my charges to the new person who is over parent services within my department. How can we build a way that a parent who needs substance abuse services or needs some other kind of service, let's say just food, like a food bank, knows where to get it? How do they look it up? How do they know that they're accepting new clients? How do they get transport there and back? I think that's a space where philanthropic partners can both help us figure it out, and maybe in this dynamic and changing world, provide some bridge, provide some access to resources, to those resources that are left. I don't know. I mean, like I said, I don't have a good answer to this one because it's a puzzle I myself am facing and trying to figure out kind of on the fly. Unfortunately, it's one of those challenges which I wasn't planning for less food in the community. That wasn't on my to-do list, sadly.
Yeah, absolutely. One of the other questions that came up is from Doris Vega. She was wondering if you can share a little bit about what DCFS's approach to small family homes is going to be, in particular for an oversight structure, but also just in general.
Yeah, small family homes uh, were a program, I don't want to say that was unregulated, but which was sort of loosely controlled. What we're trying to do is normalize and set some better standards on utilization. I don't want small family homes to become the new place to warehouse a kid. Even though it's not a congregate setting, I don't want social workers to pick, I'm putting a kid in a small family home just because it becomes easy, because it's the next open step. And I'm not saying that's happening much, but I do worry about it. If you have a resource that's super easy to access, you might put kids in there that don't necessarily need that resource and would do better with an aunt if we just looked a little harder or just waited a little longer. So really the main goal I have with small family homes right now is to make them a little more uniform, a little better understood within the department, so we can understand their capabilities. We know what they can provide a family, and we can match better the kids that need a small family home setting rather than it being a case by case negotiation or a social worker um, without a structure behind them making decisions that maybe isn't the best decision. And that's not to say small family homes aren't great. They are great, but they're great for a particular kind of kid. And I want to make sure we're doing a good job matching the kids that need them to the small family homes. And then I want to make sure that we have a common understanding of what small family homes can and should provide. Um, right now, it's been a little loose.
Yeah, absolutely. Thank you so much. You have been so informative. I believe that is all the forward-looking questions that were in the chat. Keela, feel free to jump off mute and let us know if not. We did have some questions that we wanted to focus people's attention on from here. You lifted up, I heard, I think, 6 priority areas that I'm going to put in the chat where you were shining a light because you thought community cross-sector philanthropic partnership might be really ripe for supporting what youth need and what families need. I'm going to drop those in the chat with the questions. The first question is really for us all to think about what are the opportunities for us as partners in the audience to plug in and support the priority areas. And then the second one is there anything that from your perspective as community philanthropic partners you want to lift up because you feel like it also ought to be on the list? So I'm going to drop that in the chat. Hopefully you can see that. The ones that I heard were young children in care, especially 0 to 2, the 700 youth transitioning out, overrepresentation of Black children, SPA 6 reentries, community-based prevention, and advocacy during what is a fast-moving policy change that has some severe risks embedded within it. Um, so would if folks want to come off mute and share some thoughts from your perspective, what are the opportunities for us to partner on these areas? And then also, is there anything that you'd like to lift up because you feel like it ought to have been on the list?
Rochelle, I'd like to just add one to the list real quick, if you don't mind.
Hmm.
And that is communication and navigation. We have a robust and rich system. We really do. And we're bringing up, you've seen new things all the time in partnership. But I worry that my social workers, that families, that folks in the community don't even know what's around them. And I'll give you a specific example. And I am so surprised this has not gotten more attention. We entered into an agreement with the YMCA of LA County, which gives all foster children and former foster children in an age range. I think it off the top of my head, it's 14 to 21 or 25, free access to the Y. That is out there now. It's been going for a while, and I'm not seeing as many people take advantage of that resource as possible. Just as one example, there are some great things out there, and we're having a hard time pushing the message out. So, to the extent anybody can partner with us on spreading the word, helping people navigate, getting connecting people to the resources that do exist, I don't want to see jewels like that go underutilized.
Absolutely. Other thoughts?
It's 12 to 26 for the Y. Sorry, it's Glenn.
Thank you, Glenn.
Any community or philanthropic partners have reactions around the priority areas? I know there's a lot of people on the call, but don't be intimidated.
Hi, Rochelle. This is Nancy Harris with 3FN. I want to say good morning, everyone. And Brandon, thank you for that outstanding and comprehensive presentation. There's a lot to digest and a lot to chew on. I want to thank you for raising up the urgency in SPA 6 and SPA 8. And bringing those numbers to light, and also really having a call to action for the community, not only the faith community, but the community organizations as a whole, to really figure out ways to continue to work together and to partner to push towards solutions to addressing some of these dire situations that you've highlighted. Again, thank you again for your support, especially around the ERDD movement, cultural broker movement, and addressing the disproportionality in Black children and families. So thank you for that. We again stand ready to engage and partner with whoever we need to partner with to make sure that we are addressing these issues, keeping our families safe and preventing them from being involved in the system. So I just wanted to make that statement and say continue on with the work.
Awesome. Thank you. We have one additional last question in the chat, and then I think we will close out because we're almost at time. And that was from Nicole Trimble, who just wanted to hear your perspective on where caregivers fit within all of the work that you're seeing moving forward.
Yeah. So our system will never not need non-relative caregivers, just like I think we'll never not need FFAs. There will always be a place for them. And I think we need to continue not only to recruit, but to work on how we treat caregivers so that we can retain them. Best recruiting mechanism is a caregiver that's had a good experience. And so our customer service to caregivers, our attention to caregivers will reap benefits of more willing caregivers. It's something we have been working on. I do feel like it's gotten a little better. I've personally, and Nicole's been at a couple. It's good to see Nicole. I've been out in the community myself, meeting with groups of caregivers to hear their stories of how they've been treated, what challenges they've had. That is just the start of a road we need to walk down, but we've started down that road and it needs to continue. But I will say, we're always going to need caregivers. There is not always going to be a ready, willing, and able family member to take care of all the kids that we have.
Absolutely. So Eileen put in a quote in the chat that I think is worth sharing, which is the best ship in a storm is leadership. Thank you to Brandon. I want to echo that. Thank you, Brandon, so much for your leadership, for being the kind of person who takes the time to have these conversations with partners so that we can work together on behalf of youth. We really, really appreciate it. So if you guys want to come off mute and give them a round of applause, we are just very, very grateful. And I look forward to working with all of you this year to try to fill those gaps that were lifted up.